Kirk Irby rejoins us here for this hour, and we were talking a little bit about the Omicron, or as President Brandon says, the Omnicron. There have been a lot of jokes about the name that they picked for this particular variant, and how they skipped over
Chi,
yes. Which would have
at least that's how I say it. So
yeah, but it would have. I think for some folks, it would have made it look like it was the president of China. Mm-hmm. The way the symbols are, and even though it's pronounced differently, and it's the Greek alphabet as opposed to the Chinese. But we couldn't have that. We couldn't have a variant look like the same name as the president of China, which I thought was silly.
I agree.
Should have called it what it is. You know? I mean, when we had Hurricane Hillary a few years ago, I'm surprised they let that go. Given how influential Hillary is, you know.
That's true.
So, but what I wanted to ask you about in this segment, Kirk, was where are we at with therapeutics? COVID's been around now for probably getting ready to go on 2 years now.
Yes.
We've had the vaccines, and we can talk about whether or not they're effective, and the boosters and the Omicron and all this other kind of stuff. But I think, you can correct me if I'm wrong, I think the real way that we're going to get beyond where we are now is understanding that they're viruses, they're out there, they're going to mutate. So how do we treat people when they contract a virus for the symptoms that they may get as a result of that virus? So where are we at on therapeutics right now?
I think we've come a long way just from learning about the disease and how it progresses in the body. Originally, and even now, a lot of it is symptomatic, what we call symptomatic treatment. You get inflammation in the lungs or fluid in the lungs. There's certain protocols that you do to take care of that, especially when people are in the hospital. Certain drugs, usually steroids, and then you'll use diuretics if people get extra fluid either in the lungs or around the lungs. That just helps pull this extra fluid out of the body and helps relieve some of that. So there's a couple of different things that you can do in the hospital, but also they've learned how this particular virus affects the body, and whether using a ventilator or not is good, and it kind of depends on the situation of the individual patient, and also positioning the patient, whether it's on their back or on their stomach. That seems to have some difference, and knowing what we know now, because historically when somebody's on a ventilator, they're automatically on their back. But from what I have seen, and it's been anecdotal type information, I tend not to follow hospital type information as closely as I do the other stuff. But it does seem to be, if somebody needs to be on a ventilator, having them on their stomach, and a lot of times position them on their stomach as opposed to on their back, may very well keep them from having to have a ventilator. So and I could be wrong on that, just because of the information that I have been following is not not specific for hospital treatment. But we do have a better understanding of what medications will treat these various conditions when somebody's not in the hospital. I mean, that really has helped. People are still getting prescriptions for hydroxychloroquine. There's not been any studies that have shown that it is harmful, and there's some studies that show yes, it helps. Some studies show no, it doesn't. But there's not anything that shows that it's harmful. And in my opinion, if something's not working, try something else. And so that's kind of been my personal philosophy, and I have no problems with the hydroxychloroquine or the ivermectin being used in people.
Seeing that being prescribed?
We have seen that, and various types of therapies with, you get ivermectin, and we'll have one doctor will use so many tablets the first day, and then so many each day after that for a few days, and we get other doctors that will use a standard dose, but they're doing it morning and evening. So there's just several different what we call regimens out there, but we have a fair number of people that are doctors that are using ivermectin or hydroxychloroquine, and we've kind of gotten to a point where insurance companies are not covering the hydroxychloroquine or the ivermectin in some of these therapies that it looks like they're treating COVID. So, and part of that is a lot of these contracts between insurance companies and pharmacies, healthcare providers in general. If something's not an approved therapy, they historically have been covering it, but now they're kind of like using this kind of clause that says we don't have to cover something that is not a actually approved therapy. So that's kind of been an out for some of these insurance companies to not cover the hydroxychloroquine or the ivermectin. But to the benefit of the general population, these are older drugs. There's generics out there. They're not that expensive.
I was going to say, they're if they don't get covered by insurance. Now, have you seen where insurance is saying because hydroxychloroquine or ivermectin is a part of the treatment, we're not going to cover any of the treatment? Or are they just kind of saying, well, we're taking covering this because it's approved, but we're not going to cover this because it's off-label?
We've seen them a couple of different ways, and there are so many different insurance plans out there, and you'll have an insurance company that may have 10 or 15 different plans, and each plan they treat differently. So that's why it's really hard to say, well, this is what,
right.
or even what, this is what one company is going to do, and this is what another company is going to do, because
it depends on which version of the
which plan that you have, and it's really hard to keep up with. And most of the plans will say, because generally speaking, ivermectin, when it's used in humans for its intended purpose, you're only taking it for like 1 to 3 days. If you're getting a 7-day or 10-day treatment of it, that's when they're generally rejecting those and not covering those.
Yeah.
Hydroxychloroquine's used in rheumatoid arthritis quite often, and you'll see people taking 1 or 2 tablets a day, but they take it continuously. So if you come up and somebody has a prescription that says hydroxychloroquine twice a day for 10 days, that'll get rejected, while most of the other ones that are for a 30-day supply will get covered.
Because it's part of the arthritis treatment.
Correct.
Not necessarily a COVID regimen.
Well, we've also seen some of the plans, what we call a PA. It's a prior authorization. Somebody may have been on hydroxychloroquine for a couple of years, and all of a sudden we get this rejection saying, well, it's not a covered therapy. We need a prior authorization form from the doctor. So what they're doing, they're cutting off all hydroxychloroquine therapy to everybody, and then they're making the doctor fill out a form saying, this is why I'm using it, and it's for rheumatoid arthritis, and then they'll go ahead and cover it.
Yeah.
And after they fill out the form and say it's for COVID, well, then they're not covering it. It's not getting that approval.
Yeah.
And if a doctor goes in there and puts, yes, it's for rheumatoid arthritis, just because they want to get it covered, well, then that, and it's only for a 10-day supply or even a 30-day supply, and the patient does not get it refilled, then the insurance companies can come back and find the physician.
Yeah. Oh wow, that's crazy. Well, I saw Babylon Bee had a joke. It's a parody site.
Yes.
They said Pfizer's working on their version. They don't want people to take ivermectin. They're working on their own version called Pfizermectin, which was a joke. Of course, it was kind of funny. But there are companies, the drug companies, that are working on, in essence, a COVID pill, if you will. What have you read? What have you heard about some of those items, and how far along are they?
I know that I believe it's Merck has one that is before the FDA for approval now. They've done their testing through it, which I think is still incredibly fast, considering most of these drugs will take 8 to 12 years to get to this point.
Right.
But they have really mainstreamed and fast-tracked their research. But unlike the vaccines, this has been gone through the different stages, and they've just pushed all this research together. But they've done stage 1 first. They've did stage 2. They've done stage 3. So they're doing all this. They're just working basically around the clock to try and get this. And they've got it before the FDA, and it has not gotten approved yet. They expected it to be approved last month, and it wasn't. I don't know what the FDA is actually looking at.
I have a theory.
and I well,
here's my theory. Let me tell you my theory. This is my theory. This is Gene's theory. Kirk did not say this. My theory is that they're hesitant to approve anything that might give people a thinking that they don't have to get vaccinated.
Yes.
Okay. If you have a lot of people who aren't getting the vaccine, and we have all these lawsuits, matter of fact, the courts so far have been ruling against the White House and the administration's push to mandate the vaccines.
Yes.
They've overturned or suspended, or I forget the term, for health care. The vaccine mandates for healthcare people. They've said that OSHA can't start fining companies for not mandating vaccines amongst their employees. So all of these cases so far in these lower courts have all been ruled against the administration. You can't do that. Now, does that mean they don't want? I mean, they can still encourage companies, and they can still encourage businesses and hospitals and healthcare workers to do the mandates. But as far as the government mandating this is the case. But I tend to think that they're dragging their feet, not because there's anything wrong with the Merck therapeutic, but that if people learn in great numbers that there's a pill you can take, in essence, as a treatment in case you get a COVID thing, then they're going to say, well, then what the heck do I need to get vaccinated for? And why would you do that as opposed to looking at what's overall best for the health of the people, whether it's a therapeutic pill or the vaccine? Why wouldn't you want to do an all approach? Encourage people to get vaccinated, especially people who are in a high-risk category, but also know that if people don't get vaccinated, you've got some therapeutics for the healthier people that can help them out. Why wouldn't we do everything?
I would agree with you. I think that's what we should. And one of my coworkers says, because I've kind of mentioned that before, that same thing, and he just says, well, you're thinking logically and not like a politician.
Yeah, because I would think you'd want to do everything possible to help as many people as possible. And if you've got healthy people who are at low risk, and you've got a therapeutic for them, then that's a good thing. And if you've got people that have underlying conditions and other health concerns that would probably be better off to consider, the vaccine, that the benefits of the vaccine outweigh some of the potential risks for those groups, by gosh, get out there and make sure that it's available for them to get vaccinated. Let people make that choice with their doctors and everything. I don't know, Kirk.
I agree. That just makes logic sense. So, and about this Merck drug, I don't know a lot about it, because as these drugs are being researched, that's actually considered proprietary information for the company that's researching it up until it gets approved. So there's not a lot of information out there. I think that the name's been put out there, and a lot of times you can look at the generic name of a drug and kind of infer of what category it is, or kind of how it works based on the category of medication that it's in. We know that it's an antiviral drug. The generic name fits the naming protocols of these other antiviral drugs, but other than that, a lot of it is still pretty much unknown to the general public.
Let me ask you about the vaccines. Lowell's Pharmacy has been a place where people can get the vaccine. Where are you at with that? Are people still getting their first shot, their second shot? What about boosters? How are those being processed right now?
We've kind of transformed to doing mostly boosters, but we still have people getting a first and second shot for their primary, what we call primary set of immunizations. So I wasn't there yesterday, but the day before I did 2 different people that was getting their second shot of the primary set. So there's still some people in there, because I think a lot of those people were waiting, and then now you have these deadlines, and you get some people where their bosses are saying, if you can't show me proof that you've got it, we're going to fire you. So there are some of those businesses in our area that are upholding to that, just because I think they're afraid of being fined by OSHA. I know it's being suspended, but there's a possibility if it's that suspension is revoked, I guess, that
it goes to a higher court and gets overturned.
And these people are afraid that they're going to be either fined or whatever. So we still have some people that are coming in just getting their primary or secondary shot. If it's Moderna, it's the same. Well, Moderna and J&J are the same vials, the same medication, and for the first shot and the booster. So it's not like we have to order in something different. The Pfizer does have a different shot between the adult and the children. The children's vaccine, I believe, is 1/4 of the strength of what the adult is. Since we don't have the storage facilities to keep Pfizer on our premises, that's not one that we're dealing with. So I'm just kind of going by what I've read and picked up from being in Department of Health Zoom meetings. So, but that's my understanding. It's got a different color of cap on it, so that you can easily tell what one is adult and what one is children, and the children is supposed to be 1/4 the strength. And there was the question about 2 weeks ago in a Department of Health Zoom meeting of whether you can use the adult on a child and just draw up 1/4 of the volume, and they said it makes sense, but no, you can't. Just from legal perspectives.
And you can't use a children's dose on an adult.
That is correct.
Which is kind of a shame, because there's some people, older people, that just probably shouldn't take. Well, I don't know. I'm not a doctor, so I can't say things that are not doctor based. So I'm going to keep my mouth shut.
We do occasionally have, and it's not only just COVID. There's been some people with flu shots that have had some history of some adverse reactions that we will give half a shot to, and they will come back a week or 2 weeks later and get the other half. And so they're still getting a full dose, but it's being divided up. So that is not unheard of.
Which apparently you can do with the flu
yes.
shot. But as you just learned in one of your calls.
Yeah. They are frowning on doing that with the COVID vaccines.
That's interesting. People now, flu shots. Are we seeing any flu around right now? I know flu shots have been available for a little while now, and you guys have been dishing out flu.
We have
flu shots and stuff. But what are we seeing on the flu front right now?
We really have not seen, at least through my store, very many prescriptions for flu. Flu symptoms, or there's the Tamiflu is good about fighting that. We just haven't seen many scripts for that. It's not to say that it's not here, but I think kind of what we saw last year, there was not very many flu cases because people were concerned about COVID, so they were keeping away. So it made the transmission of the flu a lot less. So we didn't see very many flu cases last year comparatively compared to the years before. I think this year we'll probably see more flu, but probably not as much as we did 2 years ago before COVID, just because some people are still a little hesitant. I still see people out wearing masks. That's an individual choice, and that's the way, in my opinion, it ought to be. I don't think government should be in on that, but that's my opinion. But I think that the flu is still here. We're just getting into the flu season for the southwest part of the country. That usually runs November, December, right around in there is the beginning, and it'll run through April. So,
and you're still seeing where it's okay for someone to get their vaccine or their second shot or their booster shot and get their flu shot. There's no recommendations against that right now.
That is correct. In fact, the New Mexico Department of Health is wanting us, every time we give a COVID vaccine, they want us to ask the patient about getting a flu shot. We tend not to, because the people that want to get it, we are getting it. So, but yes, that is, and their website that they have for us to schedule everything on for the COVID vaccines, because they're keeping track of everybody that's getting those. They have, about a month ago, they added flu shots to that same website. So
another checkbox.
Another checkbox.
So they're keeping track on you. Last question. Every day we're told the vaccines are safe.
Yes.
What have you seen? Are they mostly safe? Are you reading anything about heart issues, or what issues are people encountering from the vaccines? And I don't think it's a large number, because I think it would be reported more. Well, maybe, I don't know, but what have you read and seen as far as the safety of all these vaccines and the boosters?
It is it's generally considered safe. There are it's kind of interesting, because the Moderna one seems to have a higher rate of the problems with the heart than over the Pfizer, but those are the two. The J&J doesn't seem to have heart problems, and in males have a higher rate of having problems. But again, it's so small, it's like 0.01% of the people out there, and they think that it's due to the spike proteins that are on there. And apparently the Moderna has more spike proteins than the Pfizer, which is why it's having a little bit higher of the incident. And they also say it's the higher spike protein concentration of the Moderna is why the Moderna is lasting longer, and it has a little bit higher what we call efficacy, or the ability to work, so to speak, the way it's supposed to. So.
And these effects that may have an impact on the heart health, are these waning over time after you've had the vaccine, or are they continuing on?
It does seem to be waning over time from what I have been able to read. It happens so seldom, but again, like my dad has said, it may be a little small percentage, but if you're the one that's it's a big deal.
Of course, yeah, no question about it.
So
I know I said that was the last question, but I do have one more question. Given what you just said about the efficacy that we're seeing between Moderna and Pfizer, if someone had Pfizer vaccine for their first two, now they want to get a booster, should they get the Moderna booster, or should they get the Pfizer booster, or should you stay within your vaccine class, if you will?
They have it's been opened up for the boosters. You can get in any of the boosters. You don't have to stay with the same one that you started your first shot with. It is still important to stay with what you got for your second shot as the first shot. So if you get Pfizer to begin with, that second one needs to be Pfizer, but then the booster can be Moderna. Mm-hmm. So we can, what we call, kind of mix and match the booster. It does not have to follow. So you can get a Moderna booster when you had the Pfizer as your first one, and vice versa.
And if they really, and I said it was the last question. This is the last question. Have they given you any data? Are we seeing any data at all that combines somebody that, say, gets vaccinated and also gets COVID, or gets COVID and then gets vaccinated? Have we seen how the impact is on the efficacy of all of this protection in that group of people? Because we're told there's the vaccinated and the unvaxxed.
Yes.
And we never talk about the vaccinated and the exposed, or the unvaccinated and the exposed, which I think is another category of people that we ought to be looking at, or at least looking at the data when we're weighing all of these different decisions. So what have you read there?
Well, we should, and I still think that the natural immunity is much better than the vaccine, and that's kind of your exposure. Those people that have been exposed to it, and it shows up in their system somewhere, their blood system, their nose, whatever. They have been infected and they have the natural immunity. And you get some people, their symptoms were so light they thought it was maybe a cold that lasted a day or two. So I think there's a fair number of people out there that have had the natural immunity. And at the chamber lunch meeting that we had Wednesday, when we had the various legislators, local legislators there, I brought up that question, is why can't we use natural immunity in this? And I think our politicians, and one of them from Carlsbad, Ms. Catherine Brown, had done a lot of reading on and educated herself on this, and all of them are very interested in trying to get that as another, as being looked at as being vaccinated. But right now, as far as both the federal and state government, you're either vaccinated or you're not, and that's the only two categories they care about. And
it's interesting.
So
yeah,
it's frustrating.
Well, it is frustrating, and it is interesting because we had 2,054 cases announced on Thursday. And if we've got some parts of the state that are 70-80% vaccinated, and we've got the 5 to 12-year-olds that are, probably 40-50% vaccinated, it can't all be the unvaccinated that are getting these cases, but that's kind of what we're being told.
I think they are grouping all those together. And again, this is kind of like the flu. I talk to people about the flu shot. Well, the COVID shot, people that have been vaccinated that still wind up getting COVID are much, their bodies have a much easier time of dealing with the infection.
Right.
The people that are really sick and wind up dying from it are are pretty much the people that were not vaccinated and had no natural immunity. So there are still some of those people out there. But the people that either have the natural immunity or have the vaccine are really dealing with this infection in a much better way. Most of those people, the hospitalization rate of those people is much less, and the survivability once those people do get admitted to the hospital is also much better.
Right. Another reason why people consider getting vaccinated is with that, even with the Omicron
yes.
variant that's out there. Well, it's interesting because at this rate of new cases, between the people that have had it and the people that have been vaccinated, I would think we would hit a brick wall at some point. At some point, everybody's either going to had it, exposed, vaccinated, whatever, and I would think, we got a little over 2 million people in the state. At some point in time, we're going to say everybody's got it or had it or been exposed to it, and our new cases are going to fall off at some point, I would think. I mean, just from a pure mathematical
One would think so, but I also think that a lot of the new cases that are coming up, or maybe Delta and that type of stuff, that these newer variants are finding ways to infect people, even though they have either the vaccine or natural immunity.
Okay.
Kind of like the flu, because every year you get a flu shot. It helps protect against those specific variants, but there's maybe some other variants that may still cause you to get the flu, but your body is still able to deal with that in a much more efficient way, and you're not as sick. So I think there's a lot of that's going on out there, and I think we're going to continue to have new cases. It's just that people are going to be surviving it much easier. It's going to be more like catching the flu as opposed to catching some horrible disease that could kill you in 5 days.
Yeah. And the thing is, people still do get sick and die from the flu.
They do.
But it's not as high a percentage, apparently, or at least
That's
we're
true.
being told,
yeah,
as from the COVID. Kirk, Irby, I wish we could keep going here. Always enjoy having you in, and look forward to having you back again in the new year. But if there's any people have any questions about any of this,
sure,
they're certainly welcome to reach out to you at Lowell's Pharmacy and ask away.
That's right.
All right. Thank you,
right.
Kirk.
Take care.
Have some McDonald's.
Thank you.
We're going to take a break.